Hi, welcome to this episode of AskAwayHealth Live class. Thank you so much for joining us on today's session. My name is Dr. Sylvia. I'm a general practitioner and a health educator, the founder of AskAwayHealth, and you're back on the channel where we love to talk about everything to do with better health, preventing illness as it relates to women, but not just women, everyone connected with us, family, friends, everything to do with our health, because we're all connected. And of course, a really key aspect of our health is sexual health. So we talk about all these things related on this channel. So our Friday live classes are opportunities to look in depth at particular questions or issues that you viewers on our channel have brought up in response to a comment on a community post or a video that I've done. And yes, today's question is exactly that. Somebody's brought that in for us to talk about and to learn from. So before we dive into that, I'm just going to check that we're all doing okay. Hello there to Toriana Hardiman. Nice to see you. She says, Grand Rising Queen. Welcome to today's live stream. Please send in comments, questions related to anything alongside women's health. We're going to be talking about the Depo Shot. So if you've got a question on that particular subject related to risks, complications, how it works, and so on, please shout out, but you're welcome. And if you're just jumping on the stream, share it in your networks, share it with somebody who you think it might find it useful. Okay, marvelous. So getting ready for the weekend. I presume everyone is. What are you doing this weekend? What's interesting? Are you going to have a nice quiet weekend, or are you going to be busy doing something else? Right, don't forget to like and subscribe to the channel, like the video, subscribe to the channel. I'm just going to take this sticker off and then pull up the question. So let's just dive straight into the question for today. So this has come from one of our users, and she says, hello doc, I'm using the Depo Shot for almost 9 months. How to switch birth control from Depo Shots to other kinds of contraceptives like condoms, pills, etc. What should be our preparation? Which I think is a really great question. We're talking about how to use different birth control methods safely, how to get the best out of your method, how to deal with issues around them. So I think it's a really great question. Let's just jump into this and look at suggest ways that we can go about doing this. Now, please don't forget, you can send in your question. I usually say to people that it's difficult to give you a very detailed, concise answer on YouTube, as you know, because I'm not your primary care physician, and I don't know your medical background. So what we can do is just provide a little bit of information, and we get so many different comments and questions coming in. Realistically, we can't cover them all, but what we tend to do is pick one out every week just to look at it in detail and hopefully provide information that will be useful to a lot of people. But the other thing that you can do is hop on over to our website, AskAwayHealth.org, if you really want to get to hear from us specifically about a particular issue, some clarification or some explanation. We'll be very happy to assist. So hop on over to our website and then we'll be able to get you that information. So to this question, now, in case you don't know what the Depo Shot is, that's fine. We can talk about that. It is one of the methods of modern birth control or contraception. And it's a method that uses a hormone, a synthetic or human-made hormone called progesterone, to bring about a prevention of the egg being released from a woman's ovary, which is the process of ovulation. Now, I'm not going to go into too much detail about this because we've got lots of videos on our channel already where we explain these things. So please take a look, and I think I'll put a link in the description just in case you're not familiar with those terms. That's fine. They're really well explained on our channel. So what this birth control method does is it prevents ovulation. It can also affect what we call the cervical mucus, which is the mucus or the fluid kind of material that that is within a woman's reproductive tract or within the organs, so within the cervix and the vagina, and it's if that mucus, if it becomes thicker, it makes it difficult for sperm following intercourse. It makes it difficult for the sperm to swim and travel up into the reproductive tract and up towards the fallopian tubes where the egg is traveling down from the ovary. So this is what this hormone does. So part of the way it causes birth control or prevents pregnancy is by preventing the egg from coming out, from being released. It can also affect the cervical mucus, making it difficult for the sperm to travel. And it can also make the environment within the womb a little bit less friendly or hostile, if you like, to sperm, so they don't survive too long. All these measures are just geared towards preventing pregnancy from happening. So that's what the Depo Shot is. Most people will know it as an intramuscular injection. So this is an injection method. With birth control methods, you can have tablets, you can have coils, you can have patches, you can have rings. You can also have a combination of 2 hormones or just 1 hormone. This particular method, the Depo Shot, is 1 hormone given as an injection. That injection can be given into the muscle, which we call intramuscular. And so we know that as, some people know that as the Depo Provera, Depo Progesterone shot, or it can be self-administered, which is obviously a more recent formulation of this method. And that means that you, if you choose, can give yourself this method by giving yourself the injection into the skin around your tummy, upper thighs, and you'll be trained to do it. It's recognized as, or nearly as effective as, a health practitioner giving you the injection. And you can, of course, think about the convenience of being able to do that at home. But it's important that you're comfortable, confident, and happy with the method if you choose to go down that route. So those are the common forms of the injection progesterone. Now, I'm referring to this particular one because we commonly use those in the United Kingdom, but there are other forms that can be used in different parts of the world. With the Depo Progesterone injection, the brand that I'm talking about, we recommend that a woman is given her injection every 13 weeks. Please, that number is important, every 13 weeks. So either you go to the clinic and get your injection, and when you're giving your next appointment, it's 13 weeks from that day. Or if you're giving yourself your injection at home, you're encouraged to calculate that your next dose is due 13 weeks. It's really important from that day. So it's really important that you're keeping track of your calendar, because the contraceptive protection, the birth control effect of the injection wears away after that period. And you do have an extra 1 week, but it's just in case life happens, as it does. If you can't make your 13-week appointment and just have to delay it for a few days, it is possible to have it a little bit late, an extra week later. But really, anything after 14 weeks, we're playing in no man's land. There is no guarantee that that method, that injection, is working. So what I'm saying is that if you have the injection today, okay, and you're within the first 5 days of your period, assuming you're just starting the method today, and today is day 1 or day 2 or day 3 or day 4 or day 5 of your menstrual period, okay, you started the method, you're going to have contraceptive protection from today until 13 weeks, which is when we would usually schedule the next injection. You have birth control cover. The reason you have birth control cover from today is because we've given the injection within your menstrual period. So that day 1, day 2, day 3, day 4, day 5 I'm referring to is talking about your cycle, and you're within the bleeding phase, the menstruating phase of your cycle, okay? And that protection continues until week 13, so the 13th week. Once we get into that 13th week, what we're saying is that the protection, the birth control cover of the injection has started to go down, okay? And that protection wears away after the 13th week. But we still have a 7-day window where there is still protection. And so up to 14 weeks, you have cover. And that's when you should have the next shot of the injection. But we're looking at a situation here where somebody has been using the Depo for nearly 9 months, she says. So she's had the injection a couple of times, but she wants to switch the method. And so what's on her mind is, how do I do this safely? How do I do this and ensure that I'm being protected and my health is maintained and so on? Now, we don't know why she's coming off the method. I look at the Depo as it is one of the most effective forms of contraception. We're talking about if you stick to your calendar and you're doing this every 13 weeks, we're looking at a failure rate of less than 0.2%. So that's about 99.8% effective if everything goes to plan in the ideal circumstance. So it is quite effective. But we do appreciate that many of us do experience these hormones differently. And we range from very good experiences on the Depo to really horrendous stories. So I try not to generalize. We have to accommodate for people who have experiences along the spectrum. So it may be that she wants to change her method for whatever reason. She wants to switch to something else. But the thing is how to do it safely. Now, before I do that, I'm just going to quickly touch on, and particularly for anybody who's watching this and you're curious about the Depo and just sort of wanting to be clear in your mind about this injection method, what are the benefits and what are the risks. I'm just going to quickly touch that for a couple of minutes, and then we're going to dive into this, responding to this question. But I thought it was useful, and I do have a couple of other videos on the channel where I talk about this in detail, but just for the sake of anybody who's just sort of listening to this. So in terms of benefits, one is that the Depo, it carries a very large amount of hormone compared to the progesterone pill or the mini pill. The mini pill is a birth control method that's in the form of a tablet that you take on a daily basis, and it contains the same hormone, but the quantity in the pill is a lot less than what you've got in the injection. And one of the benefits, or one of the effects, let's call it effects first, that you can get from this injection is that you can experience no bleeding. So your periods stop, or they become very light, or some people say scanty, when you start taking the progesterone injection. Now, the reason I say let's call it an effect is because for some women that's fantastic, but for some women they don't like that. For those who find it a benefit, then they don't have to use sanitary material. They don't experience heavy bleeding and whatever issues they might have had with bleeding. So for them, it's a benefit. And so that's related to the next benefit I'm going to talk about for women, particularly those who suffer with heavy periods. Now, heavy periods can be from different causes. And please have a look at a video on my channel where I talk about doctors' approach to heavy bleeding. I talk about over 16 possible causes of heavy bleeding if you want to learn more about that. But for women who suffer with a condition known as endometriosis, again, videos on the channel, the Depo is one of the treatment options because it can help to reduce the bleeding and the pain that comes with that condition, endometriosis. One of the other benefits of using the Depo is that it is linked, I think I'm looking for the best way to say this, but it is not linked with an increased risk of ovarian or womb cancer. And in some studies suggest that women taking the Depo may have some protection against those two types of cancers, ovarian and womb cancers. So that's sort of put in the box of benefits with this method. Another benefit is that for some women who suffer with sickle cell disease, and I do talk a little bit about this condition. So I've got a playlist talking about sickle cell, the types, different types of sickle cell, genotypes, possible issues to do with combinations, possible treatments and symptoms that they experience. So please have a look if that's something that you're interested in. But the Depo Shot is one of those options, birth control options for women who have sickle cell disease. They are prone to, or they could develop what we call sickle cell crises, where because of the nature of their red blood cells, the red blood cells could block their blood vessels and form clots, or they're clots basically. So they get into the blood vessel, they clump together and sort of block the vessel. And what that can contribute is so many different things. It can cause severe pain within the bone. It can cause a reduced supply of oxygen to some organs. So that might result in things like stroke or other damages to kidneys, eyes, and so on. So that condition is already associated with a high risk of this problem, developing clots and reducing oxygen supply. Many of our birth control methods, for example, the combined pill, increase the risk of clots forming in the body. So what we're saying is for this group of women, it may not be safe for them to use such methods. The Depo studies indicate it is not associated with that kind of risk. It's not associated to any significant extent with that risk of forming clots, blood clots in the blood, in their blood vessels. And so this is a method that women who have sickle cell anemia and who need a birth control method can use, of course, with regular reviews, and hopefully that keeps them well enough and prevents them or reduces the risk of them developing crises, painful crises, or other types of complications. So these are some of the benefits that you could have with using the Depo Shot. But what about the risks? Because I said it's good to have a balance and look at both of them. Now, the Depo Shot, again, we've talked about it having a large amount of progesterone, can be linked with loss of your bone density or your bone mass. Especially when you first start taking it, there can be quite a reduction. It's not a huge amount, but it is significant enough that it's picked up in studies. And so we wouldn't usually recommend it for women or young girls under the age of 18 because they're still developing their bone mass. And for women who are older and want to take this method, we continue to review them and make sure that it is appropriate for them to have this medicine, especially if they have other conditions that could affect their bone mass. For example, if they have low vitamin D, if they've been taking long-term steroids. Again, I don't want to get off track into this because I have talked about it in another video, but it's good to explain. So that's one of the issues that you could have with the Depo Shot in terms of its risks. There's also a weak link between using the Depo Shot and breast cancer, that is while using it, and that risk is very small, but that risk also disappears when you stop it. For 5 years after stopping, your risk goes back to normal as compared to somebody else who's never used the shot. The same with a current use, when you're currently using the Depo, and a small risk of cervical cancer. So there is that association as well, breast, cervical cancers, but those risks, those small risks disappear completely once you've stopped using the method. And that's why one of the things we encourage women who are on this method, keep checking your breasts. Please go for your cervical smear, have your HPV vaccine when it's due. These are key things, and those are the things that we will check for women who will use this method. Another risk, of course, is the issue with weight gain. I'm sure you'll be shouting that out at me, so if I didn't mention that, I'll be in trouble. But there is some association. It's not with every woman who's on the Depo. In fact, I will shock you and say some people lose weight according to some studies, but more we associate it with weight gain, and this is particularly in women who are under the age of 18 again. And the other thing that was interesting in the studies was that they said that if a woman starts the Depo and within the first 12 months has put on more than 5%, within the first 6 months, has put on more than 5% of her body weight, that's one of the people who is likely to experience a lot of weight gain on the Depo. So that's a clue to guide us as to, should you be on this or not, okay? And then another issue is, with having the injection every 13 weeks, 3 months plus, you're putting it in the on the left buttock, on the right buttock, or in the shoulder, or in the abdomen. It's going into the skin. It may cause some irritation and inflammation in the skin, and so that is one of the risks, that some women can have quite difficult skin changes, hyperpigmentation that could happen with this. And of course, the big one that I should not forget is the issue about the delay in return to fertility with the Depo. That doesn't sign it off as a good method. It just means that you need to be aware, because if you intend to say, I'm going to have kids, we're going to start having kids in the next couple of years after I finish school or at this particular level of my career, and you're on the Depo, then you need to be thinking of coming off that method well before the time you want to start having kids, or actively trying, if you get my meaning. Because there is a potential there could be up to 12 months delay in return of fertility. Not because it doesn't damage your fertility, it doesn't make you infertile, it just delays the return, because it's a very large hormone. What it does, as it gets into your system, it will temporarily switch off the activities, the messages that your particular brain hormones are sending to your ovaries and womb. So it switches that off temporarily. And when you stop taking it, it takes a while for that pattern, that cycle that your body normally has to return and begin to function for you to be fertile. That's all it is. It will come back, but it takes some time. Okay, so we've looked at that, and I thought it was good to set the scene for what we wanted to discuss. I'm going to share my screen and make sure I get this right for us. I'm going to share my screen because I want us to have a look at this chart. I'm just going to talk through it because it's easier with the chart to be able to provide you with that information. So let me just make sure I've got it up now. There's always a bit of drama when I want to share screen. Is it on here? No, it's not that one. What's that one? So let's close here. Bear with me 2 moments and I'll get this out for us. So please don't forget to like the video if you're finding it useful. If you think it's really answering some questions that you have, please like it and share, and don't forget to subscribe to the channel. So where is it now? I promise you I did test this before I went live, so if it's not working, don't blame me. Let's blame technology if it's not working. It's not showing. Oh, come on. It is here. So this is the screen I want to share. Okay, let's see. Here we go. Yes, so technology looks like it's going to be our friend today. So hopefully what you should be seeing, if I'm going to minimize this and make sure, fantastic. So what you should be seeing, let me remove this as well. Fantastic. Okay, so what you should be seeing now is a graph, if you like, a pictogram from, and this is from, the source is the Faculty of Sexual and Reproductive Faculty of Sexual and Reproductive Health in the United Kingdom, provides guidelines about sexual health and contraceptive or birth control issues amongst other women's health related matters. And so this looks at what to do when you're switching from the Depo Progesterone, from the Depo Shot to other methods. Now, I'll start with condoms because my viewer mentioned condoms and what should you do. The key thing I want you to remember is that magic number, 13 weeks. 13 weeks is the important number to remember because it's at the end of 13 weeks that any contraceptive protection from the Depo begins to wear down, okay? You have an extra 7 days as a grace period, but I don't want to push and say, oh, it's 14 weeks. I would say, please hold on to 13 weeks, okay? Now, if you wanted to stop the Depo and just start using condoms, you can pretty much do that at any point. What you simply need to realize is from week 13/14, you're going to have to use the condoms every single time you have sex because you no longer have protection from the Depo Shot. That hormone, the effect to the ovulation effect and the effect of preventing pregnancy wears away from, at the maximum, from 14 weeks. So this is why if you want to switch to the condoms, you can do that from your 13 weeks, 13/14 weeks, but make sure you're using it every single time. And please remember, the condom is not the most effective form of contraception. It's great. If that's all you have, it's better than using nothing. It's more effective than relying on just the pull-out method. I have videos on the pull-out method, so please go and have a look at my discussion on the pros and the cons and the issues around the pull-out method. But please realize that the condom it's good for preventing the spread of sexually transmitted infections. That is a great benefit of the condom. It's also used as a birth control method. But these other methods that have hormones are a lot more effective. So just having that consciousness, just being aware, because there's some of us who can't use these methods. Okay, we can't use these hormone methods, but we can use the condom. It's about combining that with being aware of your rhythm and your calendar, your safe days, being aware of those things. And if you choose to use the condom then, or the female diaphragm, for example, which is another type of barrier method like the condom, but that's the one that women wear. If you choose to use those methods, just being aware of, what your safety is and what else you can do to protect yourself. So that's for condoms, okay? You can start using them as soon as you want to, being aware that from the 13th to 14th week, your contraception, your birth control protection from the Depo injection you had 13 weeks ago has already started to come down. So it's no longer safe to rely on that injection. But what if you're switching from the Depo to the coil? To the what do you call it now? The combined pill, I beg your pardon. So that contains both estrogen and progesterone, or to the mini pill. Or you want to switch from the Depo to the implant, that's the the implant that's placed underneath your skin of your upper arm, or to the coils. And we have two types of coils, the copper coil and the progesterone coil, commonly known as Mirena. What if you wanted to switch from the Depo injection to any of those methods? Time is what is critical. When you choose to do so is what is critical. Now, if you can look at my chart here, DMPA refers to Depo, and 14 weeks is the magic number, which is fine. I prefer to say to people, use 13 weeks as your guide. That extra 1 week is a grace. It's just, we keep it in our back pocket, as plan B, as, when I say plan B, not the contraceptive method, as your backup, like you have 1 week grace, but 13 weeks is the recommended time when we know the effect of the Depo Shot hormone in your body starts to wear away. So you can use any of these, you can switch to any of these methods, any of these I've mentioned, the pills, the implants, the coils, as long as it's before that 13 week period. Okay, as long as you're still within that period, it's not due, your injection is not yet due, you can happily switch, okay, to any of these methods, as long as you're still within that protection, still within that period. So that's what you can do. You can decide, okay, I don't really want to go on the Depo anymore. When is my next injection due? The 15th of August or whatever, okay? So what you decide is start taking the pill before the 15th of August. Go for your implant fitting before the 15th of August. Because what it means is that you get the implant put in place and it starts releasing its hormone. Usually, takes some time to start building its effects. But while it's doing that, there's still a bit of the effect of the Depo in your system. So while you're crossing, using those methods, you're not going to lose any contraceptive protection. So that's why it's starting. And that's, I think actually is probably the best way to go. If you can control things, it's the best way to go. When you're due for your next Depo shot, and start your new method before that, like in the week before that, then you're covered. Okay. So let's look at the next possibility. The next possibility is, if you want to switch from the Depo shot to any of these methods and it's more than 14 weeks, what's the implication of that? It means that contraceptive protection is going down, it's reducing in your bloodstream. Okay, so what would you do? If it's more than 14 weeks and you've not had sexual intercourse, you guys haven't been together, there is no chance you could be pregnant. If those are the scenarios around your context, then you can switch to any of those methods as long as you use a condom, extra protection. So that's what all these nice little icons refer to. So for the combined pill, use a condom for 7 days if you are going to have intercourse, okay, because it takes the combined pill up to 7 days to build its level in your blood. Remember, the scenario is that it's been more than 14 weeks since your shot. Okay, so that's why you're ensuring that you have extra protection during the time when the combined pill, when you've just started taking the pill. Okay, and similarly for the mini pill, but then you're allowed 2 days because it takes 2 days for the mini pill, to start building up its protective level in your system. Okay, now this middle one refers to if you were late for your Depo. So if you're more than 14 weeks late for next Depo injection, we would say the same thing. Please use extra protection for 7 days. The same for an implant. If you're more than 14 weeks past the next due date of your Depo and you want to change method to the implant, have the implant, yes, but please use extra protection for 7 days. And the same thing for the progesterone coil, Mirena, and with the copper coil. Now remember, the copper coil is also used as emergency contraception. It literally starts working once it's inserted. With the Mirena, that is the progesterone coil, you need to let the level of the hormone start working its way out of the device and come into your bloodstream. So this is what to do if you've not had unprotected intercourse within that period of time, and we're not concerned that you could be pregnant. So it may be that you need to do a pregnancy test first, or it may be that you're in a situation where you've come for this appointment to have the pill, the combined pill, but you guys did it last week, and it's been more than 14 weeks since. So the discussion that we'll be having are about, did you use an emergency birth control method? Because more than 14 weeks, no contraceptive protection. You guys have been together. Did you use emergency birth control? Those are the questions. And if you didn't, could you be pregnant? Do we need to get a pregnancy test done first before we think about any other method? But if we're sort of fairly satisfied that none of that has happened, no intercourse, then you can swap to any of these methods, and you're using extra protection. Except for the copper coil, you're using extra protection for the number of days, as I've described already. And then the last scenario is where it's been more than 14 weeks again, so we're well past the contraceptive protection from the Depo, but you've also had intercourse. Okay, so you've had intercourse. This is where that scenario that I referred to earlier, you need to use extra protection if you decide to choose that method, and do a pregnancy test at 3 weeks. Now, the discussion and the decision is for you. If you're quite certain that you have had intercourse during that period of time, you might want to say, okay, you do the pregnancy test first, use condoms, and then once the pregnancy test confirms that you're not pregnant, then you can start the method. Okay, but these are the kind of preparations that you would go through, and it's similar for the combined pill or the mini pill, using the Depo, using the implant or the Mirena coil, and then the copper coil. In any of these scenarios. Now, for the Mirena coil, what you'll be told is, unless we can confidently be sure that you're not pregnant, you'd be encouraged to use another method, really, because of obviously the possible effects of the hormone on a growing pregnancy if you were pregnant and it's too soon to tell on the pregnancy test. So you'd be encouraged to use another method. Make sure the test is negative before you can start with the Mirena coil. And with the copper IUD, that's the copper coil. And if the only sex was within the last 5 days before you come for that appointment, then you'd be thinking about, if you insert the coil, it's going to act as an emergency birth control method, really. So ideally, what you'd be advised to do is having a pregnancy test done. If there's a chance that you could be pregnant, getting the pregnancy test done, using another method, maybe sticking to condoms until we're clear what the situation is before resuming another method. So I thought it was useful to put this up so that we have a graphic display of this, and then describe what would happen. I hope that's been useful. And again, if you have specific questions on the subject, please let me know. For anybody who's just joining, let me see if I can. I'm going to stop sharing so that takes this off. There you go. So I'm going to take this off. And if anybody's joined or popped in while we're talking or watching on the replay, what we're talking about today, what we're looking at is trying to answer this question about how to switch safely from the Depo Shot to other types of contraceptives like the condoms and the pills. And I've taken you through what's required. It's a knowledge of the timing. It's a knowledge of, could you be pregnant? Those are the key things that you need to consider to be able to safely do so. So it is possible. It's just that we need specific information. So for somebody, she's been using the shot. She knows when her next appointment is. If she wants to go to start using the combined pill, for example, if it's still within a 13 or 14 week window, depending on whatever her life circumstances is, then she can go ahead to switch to the coil, to the pill. She gets her prescription and starts taking the pill, and she has protection. Okay. If however, it's more than 14 weeks, but she's not had intercourse, she can start the pill, but she's advised to use extra protection because she needs to give the pill time to get effective within her system. And then everything changes if it's more than 14 weeks and she has had sexual intercourse. The issue now is that we don't know, if she'd had sexual intercourse, 2 months ago, for example, or if she'd had intercourse within the week before she came. You can't tell, you don't know whether or not pregnancy is possible, especially if somebody hasn't had their Depo Shot for 4 or 5 weeks they're 4 or 5 weeks overdue. So somebody who's possibly 18 or 19 weeks down the line and comes and says, well, I don't want to have the shot anymore, I'd like to start this method. So what you'd like to think about is, right, in that 4 or 5 week period, and she's been with her partner, is there a chance of pregnancy? You could do a pregnancy test at that point and it might be positive, or it might not be, depending on whichever time that they had intercourse. You can't tell. So what the questions to answer now are, right, can I use any method at this point? And what we say to that is a condom will be recommended. Let's get the result of the test. If you are thinking about a method like the implants or the coil, we would say, let's get the result of the test so that we're clear whether or not you're pregnant. And some people who feel, I use an emergency. Some people could say, actually, we did come together, we had sex, and I used an emergency contraceptive method. I'm fairly confident that I took it properly, took it at the right time, and I want to get started in a method. You could say, okay, a prescription for something like the pill or the combined pill, but advise them to use a barrier method for seven days or for 2 days if it's the mini pill. So those are the kind of things that we can do. There are things that we can do, but they're important things to think about. And though it might sound a little bit technical, I just wanted to address the question. I think what's important to take away from this video is that we can definitely switch safely. Come and sit down with your healthcare provider and let them know what's your specific situation, what method are you attracted to, what method you want to use, and they can tell you if you want to do it on so day, then just make sure that you're not meeting your partner, and then you can just switch. And once you've switched, then you've got protection, and then you can go ahead without worrying about the risk of getting pregnant. So it's important to be aware of those things, and I hope using that little graphic, I hope that was quite useful for anybody who's got questions on that. So I'm just going to round up. Oh, I've got another comment here. So I've got Kizzy Atange who's saying hi, and I'm 45. Well, Kizzy, that's an interesting thing. Listen, I'm happy to go into this in more detail with you. I'm not sure if I can still share my screen. Let me see. But obviously, it's not something that we can discuss on this platform, as you can appreciate. Do you know why? Because I would need to gather more information from you. Certainly not appropriate in a public forum like this, but I will leave the link in the description box below. And if I can share my screen, I will do that. Just give me a moment and I'll see if I can bring up our website, because you can use our information service to send a request for one-to-one with the doctor. I'm going to see if I can share this with you, because if I can, then you know where to go and you know it's available. So let's see if yeah, okay, so let's share the screen. So hopefully you should be looking at my screen. So this is AskAwayHealth email information service. Just go to askawayhealth.org and click on email service. So askawayhealth.org, click on email service in the top right hand corner. And this is a service that's very easy to use. You send a private email with your health inquiry. It comes to myself or one of our clinicians, and we pick it up, gather as much information as we can from you to be able to provide. Oh, let me take this off. Sorry. Okay, so it takes off. Yeah. Okay. Yeah. Gather as much information from you to help to manage the situation with you, give you advice about what would be useful, what would be helpful. And we think that's a better way to provide you a discreet, one-to-one personal service. So please use that to put that question through, and then we can take it forward with you. All right, guys, so I'm going to round up the video here. Thank you so much for joining me. I appreciate you. Thank you so much for any comments. Thank you so much, Toriana Hardiman. I think you've been on right from the beginning. I really appreciate that. I don't know if there's anything in particular that you wanted to look at from this topic, and if there was, I hope this has answered the question. And okay, here's Kizzy. Yes, please, thanks. I'll look out for it. I'll look out and get my people to look out as well for it. And Toriana says, thank you. You're very much welcome. I hope it helped. Please send questions. Please send any comments. We can, on our videos channels, I do look at them as much as I can, and when I find interesting ones and ones that other people are asking as well, I think, oh right, people want to hear about this, and we can use that to do a video. Okay, guys, thank you so much. Lovely to be with you. Let me know what you think of the video. Please don't forget, where is my ticker? Please don't forget to like the video and subscribe to the channel, and I hope you have a great weekend until I come back to you with a new video. I actually didn't publish a video on Thursday. It was so very busy. with my daughter's end of year, all the end of year activities. My goodness. So I'm owing you a video for last Thursday. I'm going to work on that over the weekend, but we're going to be back again with a live class on Friday. So have a great time. Everybody have a good weekend and please stay safe. Take care. Bye-bye.